Folks, as of today, there are nearly 37 million reported COVID cases in the United States. 634,698 people have died. Right now, there are only 16 U.S. states and territories with mask mandates. Man, that is American Samoa, California, Connecticut, D.C., Guam, Hawaii, Illinois, Louisiana, Nevada, New Mexico, New York State, Puerto Rico, Rhode Island, U.S. Virgin Islands, Virginia, and Washington State. Earlier today, California Governor Gavin Newsom announced that all teachers and school staff must be vaccinated or undergo weekly COVID-19 testing. This is the first state in the nation with this requirement. Then you have people refusing to comply with mask mandates anywhere, especially when it comes to schools. Now, what's interesting is that in Florida, they're asking the federal government for ventilators. Yeah, ventilators, while DeSantis, the governor, Ron DeSantis, is telling school districts, I will withhold the money of the pay of superintendents and school boards if you have a mask mandate. Now, here's what I find to be interesting. Ron DeSantis, children go to a private school where they have a mask mandate. Senator Ted Cruz of Texas, Ted Cancun Cruz, whining and complaining. His kids go to the private school where they got a mask mandate. So the mandates are good enough for their children, but they want to tell public schools, no, you can't. Joining us now, Dr. Rachel Villanueva, Vice President of the National Medical Association. Glad to have you, Doc, on the show. It has to be just nerve-wracking to look at Florida asking the federal government for additional ventilators because their numbers are blowing up. Yet you have the governor who is doing everything he can to oppose the efforts. In fact, same thing happening in Texas. The governor, Greg Abbott, is asking neighboring states for help to house folks in their ICUs, but he also is saying absolutely not, don't you dare have a mask mandate.
It's ridiculous. You know, I think we have to remember to take our medical advice from the medical professionals and the scientists. And I think we have not done that. And we need to continue to do that, especially with this new Delta variant. It is extremely aggressive, easily transmissible, and it's really a different virus than what we dealt with initially last year. And so I think even though everybody is tired, we are all tired, healthcare professionals are especially tired, but we really need to remain vigilant, and especially for our community. We were disproportionately impacted when COVID came around and we didn't have a vaccine. Now we have safe and effective vaccines, and our community is really underrepresented and not taking the vaccines. And so that's really where our push needs to be right now. We need to vaccinate our communities to keep them safe and keep them healthy, keep them out of hospitals, not needing a ventilator. And we also need to do that to keep our most vulnerable population, our children, protected. All those children that actually can't take a vaccine, the under 12 at this point. We need to vaccinate adults and all those who are eligible, so all those 12 and over. We need all of those individuals to be vaccinated to help protect. Really, it's just to protect society. It's a public health crisis, and I think we need to remember that.
And again, you're seeing this battle. Today, YouTube suspended the account of Senator Rand Paul of Kentucky because he put out a video saying masks simply do not work.
Well, we know that's not true. So, you know, this is the type of misinformation and disinformation that really is affecting really our community disproportionately. If you look at the numbers of people who are vaccinated, it's overwhelmingly 2/3 of those individuals are white. And our community, I think, is about 9% of individuals who are vaccinated. So I think it's really important that really vaccinations are our primary goal. That is number one. But those mitigation strategies, using a mask, especially when indoors, social distancing, those things are really still very, very important. All those public health measures are very important. We really can't listen to individuals who don't have the interests of our communities at heart. We really need to listen to our trusted messengers, our physicians of the National Medical Association. Those are the doctors that take care of you every single day, that take care of our Black and brown communities. Those are the people we need to listen to. We don't need to listen to anybody that doesn't have our interests at the forefront.
For folks who don't know, National Medical Association is the largest organization of Black physicians.
Right.
And what do you say to the people who are so skeptical of the vaccine, who talk about the historical impact of the medical community on African Americans? I keep saying to folks, we've had numerous NMA doctors on this show. We've had NMA folks who have been saying we are going to ensure that these things are done right and proper so they do not affect African Americans in a negative way. And then you have folks go, well, you got, I literally have heard people say, you got some Black doctors who are part of this system, of the white man system as well. I'm like, well, damn, well, who the hell can you trust then?
Well, I think, I currently see patients every day. I'm an OBGYN. So I actually deal with these questions every single day. I ask every patient that comes in, whether they're vaccinated or not. I take care of pregnant women as well. I think it's really important. People have concerns, and we need to not dismiss their concerns, really just to validate them, listen to those concerns, especially in our community. We see that when individuals in Black and brown communities are given credible, factual information by people that they trust, they're more likely to get the vaccine. So I think it's really important not to give up on people who have who are concerned. I think we really need to just continue to encourage and educate and advocate for them to get the vaccine. I think we really need to keep in mind, this is a vaccine. There's not a Black vaccine or a white vaccine. There's just vaccines out there. So while there has been a history of mistrust for good reason in our community, this is not the case for the vaccine. And I think we need to kind of be able to separate things that are not related. And this is not related. What we do know right now is what's killing us is the COVID-19 virus. That is what's killing our community disproportionately. It did the first time around, and it's going to the second time around. And the Delta variant is not playing. It's looking for the people that are not vaccinated. So I think we really need to encourage our community to continue to trust the people that they go to every day to take care of their high blood pressure and their diabetes, and to take care of their grandmother and the dementia in their family. It's always concerning when people trust their doctors for those things, but then for some reason think their doctor's part of some conspiracy when it comes to the vaccine. We certainly aren't. I ran to get my vaccine. So, I had a mother who was hesitant or concerned about getting the vaccine. And it really took a few months for me to convince her to get vaccinated, and to just to reassure her that they were safe and effective. And now we have real world data. We have millions of people in the United States and around the world who have taken the vaccine. They are safe, they're effective, and we need to use them.
All right, Dr. Rachel Villanueva, President, National Medical Association. Glad to have you on the show. Thank you very much.
Thank you for having me.
All right, folks, y'all know what time it is.